Hello, everyone. Thank you for joining the Canadian Pulmonary Fibrosis Foundation tonight to hear about our 2024 Patient and Caregiver Survey. I'm Sharon Lee. I'm the Executive Director of the organization, and it's my honor and privilege to introduce our two hosts in presentation, Celine Jasuri and John Chan. Many of you will probably wonder why CPFF conducts this survey, and we do it because I firmly believe that we should never assume. We should always ask. Never assume that you know what people want, because everybody's different, right? So we should always ask. And we should figure out how to best to do this. And one of the things that you've told us through the years that I've been with CPFF in 2018, 2020, 2022, and this last one, is that, you said, we want a new drug treatment, something that will slow the progression of the disease. We want to have equitable access to oxygen, right? We want to have pulmonary rehab. And so these are some of the things that we have heard from you, and they are the drivers in everything that we create at CPFF in support of our community. And so now I'm going to turn this over to Celine Jasuri and John Chan.
Thanks, Sharon. Hi, everybody. I'm Celine. I'm with Pearl Strategy, and we've been honored to work with CPFF and their marketing team at Etal Marketing over the years on this survey. We've been trending the data so we can really help understand what's remaining stable and what's changing. And really at the core of this, we're doing our best to be your voice. We want to take what you've taught us to help you and to help others. So let's go through an overview of the survey respondents. So we did have 500 respondents total. 431 were patients and 69 are caregivers. 53% were men, 47% women, and 49% were ages 71 plus. We did have regional representation from Ontario, the West, East, and Quebec. So as I mentioned, we have been trending the data. So we're going to look at what's the same in 2024 versus 2022. So the top physical symptoms experienced were shortness of breath and general weakness. Top treatments remain the same as antifibrotic drugs and oxygen. And top daily life impacts continue to be ability to work, leisure activities, and ability to take care of their family and themselves. Top information needs are research on new treatments and answers about current treatments. And respirologists and lung doctors and the CPFF website continue to be top sources of information. Now let's look at what's different versus 2022. So delayed diagnosis. The symptom to diagnosis timeline is still slow, but it has shortened. Patients who waited less than a year to be diagnosed is actually up 8% from 2022. Caregiver burnout. So caregivers are feeling hopelessness and depression while taking care of their loved ones' day-to-day needs, and we are seeing an increase in this compared to 2022. Support group participation has bounced back from the drop that we saw in 2022, so it has now returned to 2020 levels. And time spent caregiving. So 29% of caregivers spend 6 hours a day or more on caregiving tasks, which is a significant increase from 2022, where it was 18%, and 2020, where it was 11%. And an overview of the patient in our survey. So according to our survey, the typical patient is older and lives near a city. Approximately 1 in 3 have a pre-existing condition. So 53% were male, 47% were female. IPF actually does show a higher prevalence among men, so 85% of men versus 65% of women. 7% identified as a visible minority, 3% identify as Indigenous, 87% live near a city, and 5% have had a lung transplant. And most of the patient respondents have IPF or ILD from a known cause. Most patients are over the age of 60, and almost 2/3 are 71 plus. Now looking at the caregiver. So the typical caregiver is a female family member who is showing higher levels of depression than in 2022. So 78% are female, 22% male. 45% report feelings of hopelessness and or depression. 97% of them are family members. 4% identify as a visible minority, and 1% identify as Indigenous. Being a caregiver is hard and it takes a physical and emotional toll. We ask caregivers to rank impacts on their quality of life, and feelings of hopelessness and depression, taking care of my loved ones' day-to-day needs, and impact on their physical well-being were the top-rated ones. 29% spend 6 hours a day or more on caregiving tasks. And so that's increased in 2022. That was 18%. In 2020, that was 11%. And just over half of caregivers said it has impacted their employment. 25% have had to fully stop working, and 29% have had to reduce their working hours. So let's deep dive further into the study. So one of the big findings we found was diagnosis is still slow. Patients are receiving their PF diagnosis faster than before, but many are still facing lengthy challenges in getting their diagnosis. So patients who are diagnosed in less than a year is actually up 21% versus 2022. We also asked about challenges faced when it came to diagnosis experiences. And the top themes mentioned were lack of access or being slow, lack of knowledge by healthcare professionals, misdiagnosis, and stress, fear, and lack of emotional support. Pre-existing conditions are common. So certain pre-existing conditions should flag patients for possible risk of PF. Yet people with these conditions continue to receive delayed diagnosis. So almost 2/3 of patients had pre-existing conditions for 6 or more years before experiencing serious lung or breathing problems. Almost 1/3 of patients previously diagnosed with a pre-existing condition before they developed PF. 1 in 6 with GERD. And more women than men have pre-existing conditions. So you can see on the right there, 38% of women versus 25% of men. And then if we're looking specifically at GERD, it was 19% of women, 14% of men. And rheumatoid arthritis, 9% of women, 5% of men. And the impact on life is profound. On average, respondents selected 5 symptoms that had a moderate to large impact on their life. Over half cited shortness of breath, general weakness or tiredness, and inability to enjoy leisure activities. We also asked respondents to discuss any additional areas of their life that has been impacted, and the top mentioned ones were financial impact, mental health, worry or fear, impact on travel and socializing, and that it's a hidden disease and it's hard to explain. And also 90% of patients, 50% of caregivers who were previously working had to stop or cut back. So that's a major life change and impact. Treatment side effects are significant. Patients continue to struggle with problematic drug side effects. So antifibrotics still are the most prevalent treatments, followed by oxygen therapy and anti-inflammatory drugs. Mental health counseling and emotional support continues to show a decline. Almost 2/3 of patients on medication say side effects, notably gastro, are problematic or intolerable, making the case for new treatment options. So you can see the list there of side effects that were the highest mentioned, starting with gastrointestinal, followed by fatigue, loss of appetite, nausea, weight loss, and dizziness. Another key finding was that access to oxygen is still poor. So access to oxygen prescription has improved since 2022, but still about 1 in 10 patients were unable to receive an oxygen therapy prescription when needed. And now more patients are actually paying out of pocket for their portion of their oxygen. So it was 15% in 2022, and now it's up to 19%. treatments are seen as ineffective. So patients' conditions are worsening. They're feeling like they're not treated soon enough, and they do not think they can manage their pulmonary fibrosis with their current treatment or routine. So over half of respondents feel their condition is getting worse. Almost 1 in 3 feel they are stable but not improving. And 1 in 5 said they were not treated soon enough. About 1 in 3 patients and caregivers do not feel their current treatment or routine can help them or their loved one manage their pulmonary fibrosis. The demand for information is very high. So patients need info on research, treatments, and exercise. Caregivers want resources on oxygen therapy, caregiver skills training, and self-care. So from insight to action, CPFF support groups provide patients and caregivers access to an important source of information and expertise for people at every stage of the disease. And moving on to support groups. So after a dip that we saw due to COVID-19, the support group participation, especially among patients, has risen significantly and really bounced back. About 2 in 5 patients would be interested in knowing more about support groups or programs, and about 1 in 4 caregivers. And I will hand it back to Sharon.
Thank you, Celine. So, as you can tell from our survey, we've gathered a lot of good information. And as I've always said, the Canadian Pulmonary Fibrosis Foundation, CPFF, we always believe that we should ask, never assume that we know what our community is looking for. And so, what we've recognized in the last 4 surveys is that early diagnosis is still the number one thing that all of you have told us that we need to work harder at. And that's why we're doing this campaign called Know the Signs of PF and the Tackle the Crackle. So if you went to our website and you went to the YouTube channel that CPFF has, we have a 45-second video that you can share with anybody that you know, your family doctor, anyone, that explains that if you experience chronic fatigue, your breathlessness all the time, and you're fatigued, right? And the cough, the constant coughing. Most people will say, I have this cough that won't go away. All we're saying is if you have any of those 3 symptoms, please go and ask your doctor to listen to your lungs. It's less than a minute for them to do. And if they hear any kind of crackling sound, they should make a referral for you to see a respirologist just to check it out, right? And the number 2 thing that we're working very hard on is trying to encourage new treatments. And I want to say that after nearly a decade, CPFF is very excited, and we have all 3 webinars on our YouTube site from Boehringer Ingelheim on their Fibroneer treatment, and from Pliant Therapeutics on their inhalant, and from Trevi Therapeutics for their cough. And so those are 3 treatments that are coming up, and we're hoping that they'll be successful. And we're also going to have a web page up for people who might be interested in participating in future clinical trials that will help us to find these new treatments sooner. And yes, and thank you for posting that up in our group to show where they can find this. The number 3 thing that, we sort of put ourselves as an afterthought is patient and caregiver support. CPFF tries very, very hard to make sure that no one feels that they're alone, that they don't have to deal with this journey on their own. So we have 25 support groups across the country locally, and we also have a national one. I always highly encourage everyone, participate in as many as you like, because there's nothing wrong, to share and find out, because you never know the nuggets of information that you can gather from other people that live in Newfoundland, that live in BC, that might have something that you might be able to use and help yourself in your condition, right? And same thing with caregivers. You're not alone. We know how difficult it is, how stressful it is. you're taking on a lot of responsibilities. And we know that your loved one feels frustrated too because they don't want to be a burden to you either, right? So we have a national support group program for caregivers. And we also have some testimonials where people said that for the first time, they feel like they're seen, they're heard, and that other people have been able to give them some really good, helpful tips and tricks to manage their day and also the care of their loved one. And we also have a, a Facebook page, a private one that where patients and caregivers intermingle, share their thoughts, share their concerns. And often, when somebody asks a question, almost within 5 minutes, somebody invariably will have a response and say, well, that happened to me and this is what I did. Maybe you should think about that. And we always highly encourage you to share all of your concerns with your primary healthcare provider because they can direct you and also help you to apply for some of those care that you might need so that you don't have to pay out of pocket, right? So that's where we're at. And our patient and caregiver provides invaluable real world feedback to medical researchers because I will tell you, I'm saying, well, listen, it's great that you're a good researcher, but that molecule eventually will want it to lead it to a real person. Can you think about the side effects? Can you think about how someone's going to have to manage that? And all the other things that come with that drug treatment, how it might not work with other drug treatments they are, because we know that 60% of people who have rheumatoid arthritis, out of those 60%, 10% of them will develop PF. And it's hard to manage both diseases with two different types of drugs that don't always collaborate with each other, right? And like I said, after nearly a decade, we are hopeful that there might be 3 new potential drugs coming onto the market. And when they do, CPFF is going to ask you to help us to get this onto the formulary because that means it will be reimbursed by the government. And we have to make our case for that, right? And so we're going to need you to come and help us. Just like in the next 2 years, we're going to ask all of you to come not only help us to get the new drugs onto the formulary, but we want to have equitable access to oxygen across the country. For example, in Ontario, anybody age 65 and older, you'll automatically get your entire oxygen needs covered by the government. But if you're 64 and younger, they will only cover up to 75%. So you might have to pay 25% or a little bit more for some people. And what we're saying is let's make it all equitable. Let's make it sure that anybody who needs oxygen don't have to pay out of pocket. And we're trying to work across the country on that. And we're going to need all of you to join us when we go to the parliamentary days to say, hey, we want you to cover the costs of oxygen because all of us are addicted. Oxygen is a drug. So let's just say we're all addicts, okay? We need it to survive. We need it to breathe. So let's make it equitable. And then we've also heard from all of you in our survey that pulmonary rehab is very important. And we've asked the healthcare professionals, and they agree that pulmonary rehab is very important because it helps to keep your core strength. And that means that it keeps you more viable in exercise and you could end up doing more things because you have a lot more energy. And so we also want to figure out how do we make that equitable because it seems like there are different standards, different techniques in every single province, but how do we know which one is a better thing? And can we do it on our own? So those are some of the things that we're going to be coming back to you in the near future to say, we would like to know, how do you think we should be responding? And when we have a response, we would like you to write in to your member of parliament or your MLA, depending which province you're at. And we know that this year in October, in 2024, we have elections coming up in 3 provinces, in BC, Saskatchewan, and New Brunswick. And so if you haven't, check out our website and look for our election toolkit, because in there we have some really great questions for you to ask the elected officials who want your vote to say, where do they stand on these matters that matter to you? So we highly encourage you to go there. And as always, CPFF is here. If you send us at info@cpff.ca, someone will always respond. So come ask us, tell us what you think. And if there's anything that you think we've missed, let us know. And join our private Facebook. It's moderated, has good information, and our website, cpff.ca, is full of great information, things that tell you about what vaccinations will do for you. Where can you find it if you're looking for the COVID vaccination? How can you get a reimbursement on your income tax for using electricity because you use oxygen? So we have lots of good things, and if you're traveling, we have lots of tips and tricks in there as well from people who've done it in the past. And we also have guidance about how you should approach the airlines and help asking them to help and support you in your navigating and your desire to travel somewhere, because we all want to go somewhere. And I also, too, we have some great insights by oxygen providers who say that, these are some of the things you should ask them, your provider, to see how can they accommodate you if you wanted to go to your cottage. How can you get them to deliver your oxygen there? How can you get oxygen if you're going to a different province, or if you're going into the States, or if you're going on a cruise? They should be able to help you and answer that. And if they can't, let us know, because then we would like to find out, because we like to have those information on our website so that people can enjoy their life to the fullest, right? And so that's why we have all these surveys, and we hope that the next time we have a survey in 2026, that all of you will remember and come out and fill that out and share it with all the community. And yeah, and I want to say thank you for joining us. And if there was any question from tonight, come and ask, and John Chan and Celine Jasuri will be happy to answer. I know one of the things I've always wanted to ask is that, having done our survey, and because you do surveys for others, do you think that our survey is similar to some of the other diseases that you've done? Is it the same, do you think, when it comes to support for patients, caregivers, some of those very things that it's been stated in our survey about how, there's mental stress? How do they get other coping mechanism and support? Celine, John?
John, I'll let you take that one because you might have more experience with some of the other organizations we've worked with.
Okay, hi everybody. Thank you for that question, Sharon. So to be quite open, we don't do a lot of other diseases, but when we have, we have kind of worked with other associations like heart and stroke. And I have to tell you that they don't get to the depth that you're getting. I mean, they do kind of try and understand kind of the, guide the pharmaceuticals in terms of where the treatments are needed and the side effects. But in terms of quality of life, I think one thing that CPFF does really well is to really kind of try and get into the shoes and understand and have that empathetic ear for the patients and the caregivers. Because as you see in the study, it is more than just about the treatment. It's also about their mental health and their quality of life. And I think this is one of the areas that this organization does extremely well. So we'd encourage you to definitely keep that up and kind of show this as an example of how you can serve your community and your constituents beyond just the disease itself.
Mm-hmm. And I also wanted to say that for people who are interested, we're always looking for individuals who might want to start up a support group, because they're highly needed. And I know that many people think, oh, I can't be a support group leader. But yes, you can. Basically, it's just coming together, having a conversation, just helping each other out. As I've always said when I join some of the groups, I always say to them, by supporting each other, you're saying it's okay not to be okay sometimes. Some days you just need someone to come and say, it's all right to feel this way, because you're not alone. We're here. And it's great. You feel better because then sometimes with people who live close to each other, they oftentimes would get together, go out and have coffee, tea, just to, do something because they don't have to explain their disease. They know what it is about. And they don't have to, tell people, why am I wearing oxygen? Why am I, afraid of going out because I'm afraid of catching something? And why am I wearing a mask, right? Because we're, immune compromised. And so we're always making sure that we don't expose ourselves unnecessarily to any viruses that might be out there. And for our survey, one of the things that we always say, that especially for me, is that because we have your response, guess what? I will go and speak across the country to meet the local politicians, your provincial politicians, elected officials, and also the health ministers to say, these are the things that people are feeling in your province, and we would like you to do something about it, right? How can we do something about it? And quite often I'll ask the support groups, if you, had an opportunity to speak to the health minister, what would you like them to do? And so this is one of the reasons why we created the Pucker Up Challenge, because we wanted people to understand how it feels not to be able to breathe, right? So many people don't understand. They go, well, what's the big difference? What's the big deal? You just put it on. And I said, well, the big deal is that you've got this tank that you have to lug around all day. So I would invite you to to lug around a carry-on, attach it to a skipping rope and to your belt, and try to lug that around all day. See how accessible it is when you're trying to go up the stairs, down the stairs. There's no elevators, no escalators. Then tell me how you feel about that, right? And the same thing with the breathing. People go, well, what's the big deal? Okay, well, hold your nose. Try to breathe through a straw. Even sitting, you can barely draw in enough breath. And if you're working and you're walking around, you're lugging things, that's even difficult. So if you go to our YouTube website, we have several people who took the Pucker Up Challenge, and they, has had some statements. Like one lady said, I had no idea how difficult that was just to walk and breathe at the same time. And I'm in my heels. And another person said that they actually wanted to take the straw out because they just felt they couldn't get enough oxygen in. And they couldn't think about anything other than, how do I get my next breath, right?
Wow.
So those are the things that I want the politicians to know, so that they can understand and walk a mile in your shoes, so that they can at least get the oxygen reimbursed so it doesn't come out of your pocket, and to help you to keep in better shape and form by strengthening your core with pulmonary rehab. So these are all important things. So when you tell us that what's important, that gives us ammunition and facts and numbers to tell people, especially the politicians, this is what they need to do and how are they going to address it, right? And so one of these days, I would like to have more than enough people. So how it works is that if we have at least 100 people or more in every province that will answer the survey, then we can give that as a directional directive to the government. Whereas if you don't have 100 people at least, then it's just sort of anecdotal. We can just only suggest and say this is what people would like. But we work on this hard every single day, and we advocate on your behalf, and we want you to know that you can advocate as well. So when you follow us on Facebook, when you follow us on Instagram, TikTok, or even on LinkedIn, when we are putting a call to action, please answer, please come and support this group, because we need you, your voice at the table. Your voice matters. We don't matter at all. I mean, I can say whatever I like, but it means really nothing at the end of the day. But you matter, right? Every voice matters. So we want you to come out and do that. And that's one of the reasons why we do the walk across the country, because again, we want to raise awareness. We want to educate people about what this disease is. We look healthy on the outside, but on the inside, our lungs are dying, right? And we need your support. We need people to have empathy and understanding how tired we are, how stressed we are, and to have some compassion for the people who are living with this disease. So that's one of the things that I want to add, right? And I don't know if anybody else in this stream has any other questions. If you do, please come. And I highly encourage you, like I said, come ask the questions at the CPFF Facebook, join the private group, email us at info@cpff.ca. Go to our website, cpff.ca. There's lots of information. And if you go to our AI search bar, you just put in the word that you are looking for, whatever it is, if it's oxygen, and all of the information will come up. They'll ask you, are you looking for reimbursement? Are you looking for reimbursement on your income tax for the electricity that it uses? Would you like to learn more about how to use oxygen? We have several webinars on that because many people tell us that, gosh, I get the oxygen, they tell me, and I can't remember. And it's not easy. I couldn't remember. I had to watch the webinar several times to figure out, oh, so this is where that goes. And this is where it is. Oh, and somebody asked, is the survey results on our website? Yes, it is. It's called Breathless for Change 2024. So go there, click, and read more about it, and share it. I ask you to please share that with everybody you know. And same thing, if you can't explain your disease, we have a great webinar called What is Pulmonary Fibrosis by Dr. Charlene Fell. And we have, Tackle the Crackle, which tells you about the crackling in your lungs. They're very easy signs to know so to get early diagnosis. And we also have webinars that tells you about how nutrition can help you with the side effects, as you've indicated in the survey, nausea, headaches, diarrhea. Well, we had Tracy Reed that did the mast cells, but had to keep the inflammation down and everything. And it's really, really great. Go there, have a look at it. And this past month, she did 2 great webinars called Cooking with Tracy Reed and Baking with Tracy Reed. And it's really simple and easy. And we asked her because from our survey, we know our caregivers are tired. And we thought how wonderful it'd be if we could make one pot, a stew in one pot that's delicious, nutritious, and helps the appetite of your loved one. Because so many people tell us that they don't have the appetite, and one of the problems they have is keeping the weight on. And then with the dessert, it's only 3 ingredients. I did it, and I thought, I'm not a baker, but if I can do it, I'm sure you can too. And it's not difficult. And so those are some of the things that, because we heard from you, our community, that we went and actively searched out for those types of techniques and webinars from experts to come and share their knowledge with us. So if you have other things that you would like to know, please come and tell us. We want to know, because as I always say, I never assume that I know what you're looking for. I always ask you to let us know, and then we'll do our very best to go and search out that information and have it on our website. So I just want to say thank you for joining us today. And if there are no more questions, then we'll just call it an evening, and unless Celine or John had something else to add.
Sure, if I may, I just have one more thing to add. I just want to thank you to all the people that have taken their time to contribute their answers and their responses to this survey. I think one of the things that we do want to make sure that we call out is that all the surveys that Celine and I do, the CPFF survey probably has the most engaged participants.
Yes.
So in terms of the number of people that, not only did we just present the facts, but in terms of the open ends, the time that people take to give us their open end responses and tell their stories. And so that's one area I think we can kind of help in addition to kind of showing the facts in terms of the state of the disease. It's also helping tell the stories of the patients and the caregivers behind the disease. And I think that is an untapped opportunity that we would definitely be open to helping you kind of spread that word also.
Mm-hmm. Yeah. Well, thank you, John. Thank you, Celine. Thank you, everybody, for joining us. And like I said, just remember, we're going to be putting a call out within the next 2 years to say how we're going to come together and asking you to help us to get every single province to make oxygen equitable and reimbursed. Same thing with pulmonary fibrosis for the rehab. and for the drugs. So just keep an eye out. We're going to come back and we're going to talk to you. And again, thank you so much, because I know every day that it matters to us that we help you to live the very best of your abilities. So thank you.